Okay, so I think we can make a start. So hello everyone and welcome to today's Periodontology MSc Virtual Open Day. Thank you for joining us. My name is Inbar Eshkol-Yogev. I'm currently the MSc Periodontology Program Director, the interim. And we hope that this session today will help you to understand a bit about our program. You have opportunity to ask some questions at the end of this session. We have a Q&A. Again, if you have anything in particular that you would like to know. I'm first delighted to invite as the first speaker our head of the unit, Professor Buti, that will present some slides. And this session will be recorded, if that's okay with everyone, and you'll have the opportunity to see the recording later. So welcome and thank you, Professor Buti.
Good morning, everyone. Thank you, Imba, for the introduction. This is our opportunity to go through some of the relevant information and content about this MSc Periodontology distance learning. So I'll go through with you, as Imbar said, through some slides, and hopefully I'll manage to give you a flavor of what is this program about. And then the content, as we said, will be recorded and will be available also on our website in case you wanted to access that at a later stage. And except, apart from this session where we'll be welcoming questions at the end, we'll also be happy to receive questions later on by email, and we'll share some details with you. So this one is also a great opportunity for us because this is the UCL 200-year celebration this year. So we are really proud of this milestone in terms of from academic perspective. So in terms of this MSc, as you probably have noticed by the title, this is organized as a blended learning, distance learning type of program. That means that is delivered with a component which is predominantly online, but also with some aspect of the training which happen face-to-face, on-site, on campus, here in London at the UCL Eastman Dental Institute. So the starting date of this program is the end of September. So the academic year started normally the last week of September. The program is articulated over 3 years and in the format of a certificate, diploma, at MSc. The mode of delivery allow to exit the program at different time points. So you can complete 1, 2, or 3 years. So gaining, again, either a certificate or a diploma or a full master degree. There are in total 8 modules. They are all compulsory. And the last year of the program is entirely dedicated to the development of a dissertation project. So in terms of the team, and these are some of the key members of the staff involved directly in the teaching for the MSc. They're not the only one, and I apologize in advance for those I haven't included at this stage. But we have our program director that is here today, Inbar Eshkol-Yogev. And then we have our deputy program director, Dr. Wang. And we have one of our key teacher, a newly appointed associate professor, Dr. Emiliano Zanaboni-Pink. The staff of the unit include other key members that I'll go through with you at the end. Including Miss Ruth Glover and Dr. Natalie Leo and Professor Ian Needleman. We have also a variety of other external lecturer, teacher that contribute to the components, to the theoretical and sometimes to the practical component of the training through a live lecture or pre-recorded lecture. And our administration team involved include Dre Francis and Marianne Norfolk, who support the delivery of this program. We said that this is articulated over 3 years. So the year one of this program is the certificate year include 3 modules, and I'll give you a flavor of this module as we go. And as part of the year one, there are 2 blocks of residential weeks, one in October and one in February normally. And this week are compressed week where all practical teaching or any activity that indeed involves some sort of face-to-face engagement are delivered during these weeks. So there is a large part of the material that is covered online. And then during the residential week, there are opportunity to practice on models, on plastic model or animal models, some of the essential skills that we train. The year 2 is articulated in 4 modules. And again, we go through this module to give you an idea of what they cover. And the year 2 has got 1 residential week, which is delivered normally in March. And then we have the year 3 that I mentioned before is entirely dedicated to the development of a dissertation project. And this is during this year you have there is 1 residential week, effectively 2, because it's split into 2 blocks of roughly 3 days each, one early on at the beginning of the year, one later on in February. So in terms of the type of sort of delivery of the course, we said that this is predominantly online. So there is a variety of activity and resource that are accessible through a virtual online page, which is called Moodle. And this type of activity include activities such as reading lists, which are selected for each topic, pre-recorded lecture, exercise, online quizzes, unseen clinical cases, and group activity, such as preparing sort of small presentation or literature seminar to present to the rest of the group and the teacher. So there is an element of constant engagement with the online activity, because we believe that it's important to have this regular sort of tasks in order to ensure that everyone is keeping on track with the learning content. So it's not one of those courses that you effectively can passively connect online and look at the material at any time and whenever you want. You can do that, but also you have sort of set deadline and milestone in your clinical and learning and theoretical progress that need to be met in order to progress over the training. And again, there are regular live synchronous seminar lecture that offer the opportunity to interact directly with the staff involved. There is certainly a big element of flexibility with that, meaning that these sessions are routinely recorded. This session can be accessed at a later stage. So there is that element, there is an understanding that this program is really designed to fit around the work and the life of people and allow people to carry on working in sort of the general dental settings without a massive disruption of their business and life. Say that, of course, there is the need to allocate certain time in order to fulfill the requirements for the program. And I'll come back on this later on. So Moodle, we said, is the virtual learning environment. And these are some screenshots of the 3 different Moodle page. We have a Moodle page dedicated for each academic year, certificate, diploma, and MSc dissertation. And again, this is the area, the space where all the resources are, and effectively is a companion that follow each of the students during the 3 years of the program. So let's start with some examples. So this is a typical week that is present on the Moodle page. And what does it mean a week? Effectively, the way we have designed this program is such as every Monday morning, there is the release of some content. So not all the content is accessible and open at all times. It's normally released on a Monday, and so that specific week of the academic year is dedicated to a specific topic or specific learning element. And within that week, the structure is very similar in a way. So there is an element of defining what are the learning outcomes and objectives of that specific week. So what are you expected to learn at the end of this of the specific block? There is an available selected reading list. For example, here you see the example of a week of the year 1, which is cover the topic of periodontal wound healing. As such, there will be a dedicated list of scientific paper or chapters or reference to book chapters to sort of focus your studying on these selected resources. There are some lectures that are pre-recorded on, in this case, again, covering essential element of periodontal wound healing. And then there are, under the section formative assessment, there is a dedicated task. So for those of you who are less familiar with sort of UK terminology, when you talk about formative assessment, are all those exercise tasks, small assessments, small assignments that do not count directly towards the final sort of module mark, but are still opportunity to learn in preparation of the final exam, which are called summative assessments. So each week presents some sort of activity that help you preparing, or help you learning, but also preparing to the final exams. This is an example of one of the reading lists I was saying before, periodontal wound healing. And you can see here that as part of becoming an UCL a CL student, you will gain access to a very large library of articles, books, and so on. These are all available online, so and include most of the relevant clinical journal, scientific journal in dentistry, and of course in periodontology. So Journal of Clinical Periodontology, Journal of Periodontology, Journal of Periodontal Research, and so on. So you will have the ability to access and download this paper. And these are selected and grouped into sort of essential readings, so that we really feel that are key for the learning, and those that are recommended, and those that remain optional. So there is an element again of flexibility, so focusing on some of the essential, but then being able to go back and learn more based on the reading list. Another element of this program, as part of it, we have some forum. There is a general forum, which it's got the purpose of a platform, being a platform where you can ask questions on every aspect of the program. And also we have a dedicated clinical forum where we invite students to ask clinical questions. Yeah, this is more like an ongoing so the dynamic space where students can ask, I don't know, a question about a clinical case, how to maybe to approach this, a specific clinical challenges and so on. So you'll see here some example of conversation or between some staff member and students within this forum. We haven't mentioned yet, but of course there is a clinical element in this program, meaning that we do not, there's not a direct aspect of clinical supervision of patient. However, we have a sort of distance element of supervision of patient. So students and are, as part of the program, need to demonstrate a regular engagement with patient with periodontal needs. And so there is an online clinical logbook, and you see here some screenshots that are taken from this, where for each clinical episode where a students treat or see a patient in their dental practice, they are invited to record this on this logbook. So, and this has been specifically created for this program. And as you can see, allowed to log in patient appointments, including, the type of diagnosis, treatment planning, type of performance or procedure performed, outcome of this procedure, an element, of course, of reflection on the case done. So this is as I said, something that we monitor regularly, and we expect students that join this program to complete at least 100 patient entries, so 100 patient visits, to demonstrate this regular engagement with clinical activity focused on periodontology. So beyond the clinical logbook, then there is an expectation as part of the final assessment for the program to prepare and submit some clinical cases. So in the year one of the training, overall, there is a need to prepare and submit 3 clinical cases as part of 2 different modules. For the year one, the focus is on non-surgical aspect of treatment, so it's diagnosis, prognosis, treatment planning, and delivery of non-surgical periodontal therapy. So in the new terminology, delivery of supragingival and subgingival PMPR and instrumentation. So these cases are, again, done in practice, but we offer regular support to sort of prepare and develop these cases. So you see here in the year one, going into a bit more into details, there are 3 modules: the scientific basis of periodontology, periodontal diagnosis and treatment planning, and non-surgical periodontal therapy. So these cover different aspects. So the scientific basis of periodontology module, as you can imagine, this cover really fundamental knowledge in periodontology. So aspect of etiology, pathogenesis of disease, microbiological aspect, and anatomical aspect, wound healing aspect, all these key element of the theoretical fundamental knowledge in periodontology. While the other 2 modules, periodontal diagnosis and treatment planning and non-surgical periodontal therapy, are more clinically oriented modules. So the periodontal diagnosis and treatment planning is a relatively short module that is aimed at set the basis for a correct diagnosis, for a correct prognosis, and for a correct preparation of a clinical case in terms of also formatting, because one of the skill we really are keen to teach is how to prepare a case at the level such that can be presented not only here, but for example, in conference or for poster presentation, abstract presentation, and so on. So as part of the year one, alongside the specific content related to periodontology, we have training on dental photography. We have specific training of radiology that again aim at comprehensively build a portfolio for case presentation. So year one, again, we start looking at key aspect of assessment of a periodontal case. So all the aspect of soft tissue assessment, hard tissue assessment, how to describe the clinical presentation from a periodontal standpoint, how to appreciate difference of, soft tissue in terms of quality, texture, inflammation, all of these elements that are key for skills for periodontal assessment. We also, again, spend quite a lot of time understanding how to report the findings of radiographs, and specifically how these radiographic findings correlate with the clinical presentation. So there is emphasis of understanding, pattern of bone loss, severity of bone loss, radiographic presence of infrabony defect, horizontal bone loss, furcation defect, all of these, and how to effectively report these findings. I mentioned about dental photography. Again, this is a very, very very important part of the training, because not only for case documentation, but also for appreciation of outcomes of therapy, change between baseline and post-op, appreciation of fine details of the assessment and treatment that we provide. So we have dedicated session during the residential week that are aimed to practice dental photography and to learn the skills for a good case documentation. So this, again, part of a broader documentation of a clinical case. I just here show you an example of a video that we have on the virtual Moodle page that is prepared as a pre-recorded video, but is a learning tool before joining the residential week. So it's to give an overview of how to perform a periodontal examination.
Good morning, Mr. Shah. How are you doing?
Yeah, I'm really good, thank you.
Good. My name's Dr. Mehta, and I'm the periodontist here. I'm going to be doing an assessment of your teeth and your gums today. This is Victoria. She's going to be nursing with us as well.
Hi.
Okay, so I believe your dentist has referred you with regards to some concerns about your gums. I'm going to go through some questions with you first to hear things from your point of view, and then I'm going to pop you back in the chair and do a clinical examination. If we need to take some x-rays, we'll do those then, and then I'll go through everything with you afterwards. Is that okay?
Yeah, that's great.
Perfect. So from your point of view, do you have any concerns regarding your teeth or your gums?
Yeah, I do feel that my gums are bleeding, and I do have some teeth that are moving a little bit as well, and I'm really afraid that I might be losing them. And I also have receding gums.
Okay. And do you experience any difficulty in chewing, or do you get a lot of food stuck in between your teeth?
Well, sometimes I get some food stuck around my back teeth, and it's really...
So I'll just stop it here. This is just to give you an idea what is the type of content that you have. For example, here there is, as part of this video, you see the periodontal chart and how this is recorded in sort of give you some how to follow step by step.
30, 20, 30, 30, 20, 60.
Okay, so this is effectively, and then once this is online content. Then during the residential week, we go through on a series of exercise, including working on each other to try to refine, for example, skills in probing, calibration in periodontal probing, and we do the same clearly also for instrumentation. Okay, so this is again another example, just to give you another example of the type of resources that you can find on our virtual learning page. This is a short video that show you the one of the key instruments that we use, the UNC 15 periodontal probe. So, and again, this is you'll find a lot of these resources that help you to familiarize, in this case, with sort of critical aspect of techniques. In this case, we start from the basic, and we have some models that allow to see in transparency the periodontal probe. These are, again, models that are specifically designed for periodontal assessment. So we have this model and other models that include anatomical defect, such as furcation, intrabony defect, so allow to practice a series of exercise to familiarize and learn techniques. Yeah, so these again some of the snapshot from this video. You can see the and as we go through this video, either in person or recorded, we discuss about all the aspects that for example, in this case, the inclination of the probe, the pressure, the movement, and all the critical aspects that are part of the assessment. Other important, clearly, elements that are discussed in the year one of this MSc is the application of the classification of and diagnosis of periodontal disease. So here, I'm sure you are familiar with sort of BSP implementation of the 2017 classification. So we discuss in depth all these, including having sort of case scenario with clinical and radiographic cases, and we can discuss about how we sort of diagnose and how we apply then the flowchart from the BSP as part of our comprehensive assessment. This is an example of another aspect that we focus as part of the year one teaching, so periodontal prognosis. And what you see here is one of the exercises that are present on Moodle. So there is typically short cases, such as with a clinical photograph, a clinical radiograph, and a snapshot of the periodontal chart. And then, the part of the task of the formative assessment is to reach a prognosis and then justify the prognosis. And then we have online session where we discuss about the feedback. We give you some feedback on this. This is again another example of a short video that focus on curette and instrumentation. So you see here, so initially we go through the instrument itself, the different component of the instrument, the handle, the lower shank, the cutting edge, the differentiation between universal and Gracie curette, the use of scaler. And again, you can see here some periodontal models and some pre-recorded video that help you to understand correct positioning of, in this case, a 1314 Gracie curette. So before you come to the lab, then you have some tutorial that should help in gaining confidence on the instrumentation technique. And then when you come to the lab, we practice. And again, typically we have very sort of close supervision during this week, having 2 or 3 members of staff present for each session, with a number of students normally between 5 and 10. So you understand there is a quite close supervision level. I was mentioning before about the importance of presenting clinical case. So we provide a dedicated PowerPoint template with key element that needs to be included as part of the case presentation. You see here sort of the clinical photograph element, the radiographic element, the periodontal charting, the medical history, the prognosis. And again, we have some tutorial online that help you to understand how to prepare your case and to present your case. These are some snapshots, again, photos from residential weeks. So this is in particular is taken during a literature seminar session. Again, some material was given before, and each of the students had to prepare a selected number of papers. So as part of it, then there is a session during the residential week where things can be discussed. So just 1 second, because I am sure if I'm still sharing the screen. Can I check that Imba that I'm still sharing the screen?
No, we cannot see your screen.
Yeah, so it's probably went off for some reason. Back on track?
Yes, thank you.
Thank you. So again, this is one of the sessions. You see one of the students presenting.
Sorry, just I think it's not presenter mode. We can see only like a very small window. Yeah. Like it's not in full screen. Yeah,
Okay.
sorry. Okay, thank you.
Here. And these are some screenshots taken from some photographs taken from the residential weeks. In particular, here you see exercise on instrumentation. You see Himbar in action explaining how to record a periodontal chart. And also you see we provide set of instrument, different type of Gracie curette, scaler, etc. So you can practice also working on each other. So on models, but also on directly on your colleagues, and recap session on clinical photography. These are our labs. So we are very fortunate because these are, or I wouldn't say brand new now, but they're fairly recently refurbished area. So we have brand new sort of phantom head facility where you can practice, in this case, instrumentation. And then we have, facility to screen share whatever activity we do. So when we teach, we can demonstrate techniques through the camera. You can see in your sitting at your table how the specific technique is performed before actually practicing on the model. So this is effectively what is the key element of the first year of the training. Then the second year, so the diploma year, instead expand some of the concept of the year one. So you see there are 4 modules here. The complicating factors and other oral condition is a module that includes managing of periodontal patient with some element of a complex management. This can be some sort of complex systemic condition, can be aspect of oral medicine, oral pathology, can be managing difficult patients in general. So this module again is focusing on consolidating the knowledge of the year one, but expanding with interdisciplinary elements. Then there is a module of evidence-based healthcare. This is a module that prepare, give the fundamental of methodology of research. It's very short module, but help preparing with key concept for the dissertation year, which is in the year 3 of training. And then you can see there are two modules that are more surgically oriented, the surgical periodontal therapy and the implant therapy and peri-implant disease module. Now, it's important to highlight here, normally pause here. This is to say that this program, so this MSc distance learning, is what we call a level 2 type of program. So it is important to specify. So it's not a program designed to prepare at specialist level. And level 2 is a level that's sitting between the general dentist and the specialist. And the reason why it's not at specialist level is predominantly because it does not include a component of direct clinical supervision of patients. So you can understand that there are some limitation in what can be taught effectively in a sort of distance learning type of training. However, the component and the content of the module follows very closely what we teach for the full-time program. So in this, for example, when we talk about the surgical module, we cover the most important technique and we practice the most important surgical technique. So I'll come back on this. This is a slide that I always sort of like to include in this presentation because it reminds us of a time that we would like to forget, which is COVID. But then we started the program literally the few months before the pandemic, and we set up everything for our residential week, and then COVID hit, and then we couldn't have any students coming to London for the practical components. So these are a training pack that we prepared and shipped all over the world, and we managed to deliver the practical session remotely with cameras and in streaming. Of course, this is a less than ideal situation. We hope we don't have ever to repeat something like this. But just to say that in extreme situation or specific needs, we are able to deliver also some element of practical training in a remote fashion. So this kit will include periodontal models, instruments, and all necessary to sort of practice key aspect of training. Here you see myself a few years ago now recording a lot of the material that you can still find on Moodle. So that was again mostly this during COVID time. You see that very sort of isolated in this lab recording everything. In terms of again, you see other snapshot here of the lab skill. You see some of the kits, the instruments that you can use during this week. So there are some non-surgical kit and some surgical kits and then we discussed about all the instruments and all the important material, suturing, you know, whatever aspect is related to the actual training of non-surgical and surgical skills. And you can see here some of the models that we use, the plastic model that simulate gum disease. Again, these are some other view of the instrument and the lab. This again, just to give you a flavor of some of the training and what we did or when we explain surgical techniques. So I'll let this run for a bit. What about the 6?
Around the 6, I think is like around 9-10 millimeters distal. Yeah. The pocket.
Okay. So what design would you do?
Maintain the paramarginal as well.
Maintain the paramarginal. So tell me what, if I'm doing a paramarginal here, then what do I do at this point? Carry on?
Carry on, and then maybe stop a little bit before.
Okay, so I'll stop here. Okay, so if I do my incision.
Yeah. Stop there. Yeah.
Stop there. Okay. So again, this is like a live kind of discussion that, when you see you have the demonstration done, and then there is an element of understanding and discussing techniques. Here again, you see some of the perio models simulating calculus, but also simulating gingival recession, horizontal bone loss, gap in between the teeth. So here we can use this model. We use this model for treatment planning and for demonstration of surgical technique. For example, here we are explaining how to design a flap for root coverage procedure, so some sort of periodontal plastic surgery. And again, here how positioning of the blade, inclination. You see also on the right simulation on how to perform a partial thickness type of incision. So this model allow, together with the pig jaws, to practice flap design. Again, trimming of papilla, deepithelialization of papilla, suturing technique, depending on what type of therapy we provide. And again, this is another short video that recorded when we were doing sort of suturing technique. We said we have done the horizontal external, with the same concept. We could do an horizontal internal. So basically, instead of coming out on the same flap like we have done before, we enter, and then because it's internal, if you remember, in this case we go inside again, so we go on the other flap. Okay, so this is the first part. Then we come back, but this time, because it's horizontal, again we move either more distally or more mesially, in this case more distally. We go in. Okay, so again, just to give you an idea of, this is a close view of a practice session of different type of suturing technique, which is part of the teaching of the year 2 of the residential week that we have in March. We said we have done the horizontal. And again, these are other photos showing you some other demonstration. For example, you see the picture in the middle, the creation of a trapezoidal flap for root coverage procedure. So how and on the left, how we raise the flap, and on the right, how we start performing different layer of flap with the, releasing the periosteum, leaving the periosteum attached, and mobilizing the flap to achieve root coverage. So you see, these are all a sequence of exercise that we do in the residential week. This is another one where, when we practice the harvesting of a graft from the palate. In this case, you see an upper jaw of an animal, of a pig, and then all the steps that include the modification of the graft, the deepithelialization of the graft, the adaptation, etc., etc. So these are all again activity that are part of the residential week. This is again other short video, once more to give you a flavor of some of the.
Did everybody understand that? Or anybody still have questions? Because that's a very important concept and is actually key in terms of the stability and the healing and the aesthetic outcome. So if anybody didn't have it very clear, we can repeat it again.
Can you repeat it, Eva?
So what Roberto was saying is about the design of the trapezoid, yeah, of the flap for your single incision. So you can either do, as he described, a triangular. So your vertical incisions will end into a triangle, into a very thin line. The other option is going to be when you have like a more trapezoidal. And the differences between the two are going to be where you adapt your papilla at the end of it. Let me see if I can do a small drawing of this, and that may be a bit more clarified.
Again, okay, so just some sort of discussion on how to perform, in this case, a flap 4 root coverage procedure. These are, on occasion, we had some external lecturer that have been able to deliver like a live surgery activity. For example, like in this case, this was a surgery stream from a practice in Florence with one of our colleagues and friends, Professor Rotundo, performing a corner advanced flap on a lower incisor. And you see here the step of papilla deepithelialization, which is, again, this is linked to the exercise that we do on the model. So you see, you have the models, you have the theoretical knowledge online, you have the models and the pig jaws to practice, and then you can compare to the sort of clinical elements of it. Okay, so this, you see the live streaming of the event. Overall, I mean, it's fair to say that we really enjoy doing what we do. So, and I hope this it's communicated to all of our students. Again, we had over the years some very good groups and very good memories to share, lots of social events, and so this is a cohort, I think one of the first group that actually enrolled in the program, and again was really a good memory, a good bonding for us and for the students that joined the year. Where are we? So in terms of, as we said, this is an online program. However, you are expected to come to London for the lab week. We are located, the Eastman is located in very central in London, really at the back of the main UCLH hospital, so close to Euston Square, King's Cross station. So it's a very sort of central site, and we are now split in two, in the sense that the university, the institute, and the hospital that used to be together before 2019 now are separated, but again, really close. One is around the corner to the other. And the hospital, again, is a new state-of-art hospital that was completed again in 2020. And also the institutes have got, although the building is an old building, the facility inside has been refurbished. So we have 90 labs, around 88, 90 phantom head in the lab skill. We have a dedicated clinical suite with 8 dental chair, with combined CT scan, OPG machine, radiograph, a full set of cameras for dental photography. So it's a very nice space to be and work on. I have here a short video. This is just a rendering, just to give you an idea of the space that was on the 4th floor of the Rockefeller building. This is just the area. Again, it's a rendering, and it was done this before we actually moved in, so everyone was really excited to see how it will look like in 2020. And this is effectively how the room are, and they can be open or sort of separated depending on the number of students, the type of activity. You can see on the screen that where the can be treat for learning purposes. Okay, so this is effectively a very nice space. Yeah, we host a number of other activities, including CPD courses. So it's very good area. And this one to give you again a flavor of the clinical suite. So this is still in the Rockefeller building on the second floor, and we have and this is the space where we do the clinical practice. So you see here a cohort of MSc students doing, the assessment. This is me observing what one of the students is doing. And for example, this is about positioning of and use of different type of instruments and curette. So we discuss as part of it the correct operator position, the correct grasping, adaptation of the instruments, instrumentation technique, and so on. This is a view of the clinical suite. This is a space that is being developed for teaching, but also for research purposes. So we perform here, for example, the calibration exercise for the research projects that we have in the year 3. Again, this is just to give you an idea of the space that that we have at the Rockefeller. Okay, as we said, social event is something that we always enjoy. This is some picture of previous cohort of grads during the 2019 is when we were still at the old Eastman in Grazing Road before we moved. And then you see some picture of graduation, some events, and then on the bottom left you see the picture in front of the Rockefeller building, which is where we are now and where the institute is now based. And as I said to you at the beginning, the staff, I show you some key player for our unit, but there are others that because we have two, as part of the unit of periodontology, we have two programs, not only the MSc distance learning, but also full-time and clean dent. So we have, in some of this picture, you can see some of our students and staff. So we have Professor Jan Niedelman next to me on my right, and then Dr. Natalie Leo, the second, again, from the left, from you looking at the screen. And then another picture, you see the celebration of the M-Clean Dent completing their EFP master program with myself in the picture, Dr. Eshkoryov, Dr. Leo, Dr. Wang, and Professor Shapira, which was our external examiner for the European Federation of Periodontology. And again, some picture from the graduation and from our joining the British Society of Periodontology. And we had an award from our M-Clean Dent students on systematic review. This is Vanessa, recently awarded for a big work supervised by Dr. Eshkolyov, which was really well perceived. This is our Instagram page, so please, you can keep updated what we do if you want to follow us. You've got some other videos and some other ideas of what we do. So that's our page. And yeah, I think with this, I think I pretty much covered everything I wanted. In terms of just another couple of comments in terms of the admission process. So to join this program, the criteria are effectively to have at least 2 years of clinical experience after graduation. Then there are some English requirements which need to be met from the perspective. In terms of the number of number of students per year, we normally accept between 5 and 10 maximum students. So an average of probably 6, 7, 8 students per year. I haven't really mentioned, but an important aspect is the dissertation year. So the project is something we really care about as part of the program, and we have for a number of years now implemented a model that includes some clinical research done in the individual practice. So we have implemented the model where each student working in their private practice act as a sort of individual center for data collection and of, for example, different type of studies for screening, for quality of life evaluation, for perception of from patient point of view of the oral health. So there is a number of real life clinical research that we implement during the dissertation year. So it's also an opportunity to learn about that. I mentioned to you about the type of program. Again, we accept UK and overseas students, so it's really a global program from that perspective. We have candidates from New Zealand, from China, we had from South Africa, we had from different parts of Europe, and so on. So it's really from Jamaica. We have a really a large and diverse population of students join the program, which I think is really great to see. And we try to adapt, of course, to the different reality and different settings, because, of course, there are differences across the world on how clinical and care is delivered. So I think it's a strength of the program to have that. And what else? I think I mentioned to you about the level 2. So this program, again, is aimed to develop competencies at the level 2. It's important to say that now the Royal College of Surgeons have established very recently a diploma exam, which again, this program offers an opportunity to gain these competencies and apply to these exams. So this is another important point. And the other element, again, just to reinforce the aspect of the flexibility of the program. So the blended learning nature of the program allow the kind of possibility to work and studies. Say that, of course, we always recommend to allocate 1.5 to 2 days minimum per week for learning and studying. So this is important because although everyone is different, from experience we have and former students, that's sort of really important to allocate some times over the week just to dedicate to keep on top of the material, keep on top of the Moodle page. Right, so I think I covered everything. I don't know, I'll ask Imba if there is anything she wants to add on what I've just covered.
Thank you, Jacopo, for this comprehensive overview. I think you really mentioned all the important points and covered everything. From my point of view, just again echoing what you've said, I think the main thing here is that if you are a busy practitioner that is interested in periodontology, however, from some reason not able to take the full-time program, I think this is a very good way still to be flexible and get this knowledge and more practical tools, so you will be able to treat more complex cases. I'm sure that all of you, as a clinician, seeing many perio patients every day. So I think that, again, from what we see in our program in the recent years, that it's really giving tools to get to another level and to provide better treatment. And again, if you want also for your self-development. As you mentioned, it's an international program that can be flexible for, again, if you're coming from different places over the world. And mainly, I think it's your way to be part of one of the best universities in the world. I know that today there are many courses available, but this is UCL again is one of the best in UK and again worldwide. So something to consider. Also, our staff are involved internationally in research and clinical guidelines and different clinical activities. You can again read everything in our website and get more information. So thank you, and thank you also for our former student Nancy that has joined us for the Q&A. So if you also have any questions now, I see that we have some questions already in the forum, and also for us or for Nancy. So feel free to ask. I'll start with reading the questions, so we'll see how we can reply. So the first question is this all course, which is 3 years, is online? So yeah, Jacopo, would you like to?
No.
So as we mentioned, most of the course is delivered online. The way it's being done again, so we have our Moodle page where you have all the material that can be accessed online. We have loads of online sessions with case discussions and clinical cases, and again being delivered online. But every year, the first, second, and the third, you have between 1 to 2 residential weeks in London where we do more practical practice on pig jaws and other clinical activities. So it's mostly online, but it's blended learning, which also including some face-to-face activities.
Yes. So thank you, Imba. Yes. So there are again blocks weeks. So the residential week are face to face. Yeah. So and they are compulsory. So it's just we expect everyone to turn out and just and we are very compressed. Sort of they are really all on or mostly focused on practical aspect of teaching. Yes.
Thank you. The next questions I can see here is whether it is 1 year certificate, diploma, or MSc.
So the program is 3 years. Yeah. So the year 1 is the certificate year. The year 2 is the diploma. The year 3 is the master, meaning that after 1 year, so if you have completed all the modules of the year 1, then you are eligible to exit the program with a certificate. So you can decide after 1 year to complete, exit, and get your postgraduate certificate, or you can stay for a second year. If you complete all of the module, year 1 and year 2, then you can exit with a diploma. Or you can stay and complete the full 3 years program and then be awarded a master.
Which we highly encourage to.
Yes. Yeah.
Thank you. Next, we have a question regarding implants. If the students learn how to place implants, so implant placement is not part of our curriculum. However, we do have some modules that's about how treating peri-implantitis and how to treat inflammation, how to diagnose and peri-implant disease. We also can sometimes able to be part of the hospital implant week. Again, we cannot guarantee for sure every year, but we are trying. But it's not focused on implant placement. It's more about treatment on periodontal disease and peri-implant disease.
Yeah, that's an important point. So this is a periodontology master program. Of course, periodontology nowadays include implants or at least, important aspect of management of soft and hard tissue around the implant. But this is beyond the remit of this program. You understand that this is a distance learning program. So it's not aimed at learning how to treatment plan place implant as such. We do cover, we have a module dedicated on implant, but again, it's mainly on diagnosis of peri-implant pathology, understanding the fundamental aspect of, if a patient comes to you with implants, how you can manage that, how you can manage peri-implant mucositis, perhaps some aspect of peri-implantitis, non-surgical elements, some concept of surgical management. And yes, there is our hospital, the Eastman Dental Hospital, organize what they call an implant week, which is a week of training on implants. This is not part of this program, but on occasion we have been able to offer that and extend to students. Again, this is not organized by us as such, meaning by UCL, but it's organized by the hospital. But there is the opportunity often to join that. So yeah, to answer the question is not, so if the goal is to learn or gain extensive experience on implants, this is not what can discover in this program.
Thank you. The next question, they're asking if we want to become a specialist after, would we get help with this, or is there any pathway? So as previously again mentioned, this is a level 2 program. Due to the nature of the program, which is not full-time and not face-to-face, where we cannot supervise you while you're doing any clinical work, and it's an online program, so it's a level 2. But I think it also really depends where you're coming from, because every country has its own pathway, and also it depends on your previous experience. So it can be included as part of, again, your CV, but it's not a kind of a direct pathway for a specialist list. Jacopo can, I think, elaborate more on that.
Yeah, no, absolutely. I think you covered well. So as I said, because it's in order to be eligible to apply for the specialist list, the college and the GDC, they require a formal component of direct supervision of patients. So this is not something that is part of this program. Of course, in a recent year, there's been a lot of change in terms of the pathway and how to access the specialist list. And you might be aware in the UK, there is a sort of the possibility to try and apply through a sort of not direct access way, but submitting, your CV, your portfolio, your experience, your training. So if this can be one element of maybe a wider portfolio, and each case is judged individually by the dental council, certainly can be of help, but as such is not, it doesn't give you the eligibility to sit an MRD exam, if that's the question. And we do not as such offer specific training on that, because it's beyond the remit of this program in terms of preparing you for a specialist exam.
I've got something to add on this, if I can.
Of course.
So I've been through the program, and I finished, is it 2 years ago now? I don't know. Time passes quite quickly when you're not studying. So with regards to this specialist thing, it depends what you make out of your career. Because obviously when you finish this program, you would have the title, if we can call it that, dental with special interest in perio. And I never really struggled to find jobs. So I found perio-focused jobs ever since I was still a student on the master's. And everyone who's advertising for jobs now, ideally you'd be looking at private practice basically, and they would advertise the job for a periodontist, but then you go and apply and say, I have a master's degree from UCL, the Eastman, and they would offer you the job depending on obviously how good you are and how qualified you are. So this title of being a specialist, unless you want to be a specialist on the specialist list of the GDC, doesn't really identify your work opportunities, because like I said, ever since I started, that was back in 21, I think. I've applied for jobs. I got every single job I applied for, and currently I'm working in 6 practices. I mean, I've been lucky and fortunate, but it's what you make out of your learning, and it's how you apply your learning in a clinical setting. And if your employer sees that you're confident, you know what you're talking about, they know that your patients are in safe hands. The title specialist doesn't really make that much of a difference. So I hope this is helpful.
I think that's a nice comment, Nancy. And I think, and can I add this? I mean, it's nice, I think from my perspective, and Nancy joined us already now for a few times in running this session and this open event. And every time, we can see how her career has progressed from the year before. And this again, is an example of how you can make the most of it of some things, not only in terms of, I mean, certainly outside there is a massive need of, separate somehow yourself from, not in a bad way, but just to gain these extra portfolio and skills, certainly in perio, to deliver confidently a lot of aspect of certainly non-surgical therapy and something more. That's one element, but also there is an element that, for example, no teaching opportunity, correct me if I'm wrong, Nancy, I've been involved in a number of activities, teaching conferences that, helped you shape your careers, which is very, very nice to see. So, of course, there is differences. Yeah. So we need to be clear. I mean, there is, you need to think about what is your career trajectory, what you want to do. This is very, very important. And if your focus is to be a specialist, then of course you need to think about the opportunity to embark in a full-time program. But as we said before, there are a lot of opportunities that can arise in that perspective. And again, I can see more now more than before, there are sometimes challenges for people to commit for a three years full-time program for a number of reasons: life, family, financial commitments, etc., etc. So I think all these things is something that may help, and it's depends on the individual circumstance, but can help you to make that decision of what is the best pathway for you.
It's probably also worth mentioning is that the MSc program gives you such depth of knowledge, very comparable to what you learn on the full-time program. And therefore, in terms of learning and qualification, employers appreciate that. In terms of clinical application of that, one of the best things about this program is that what you learn, you can apply straight away. And the supervisors are there to support you and help you. And simple things as even doing a perio assessment on a patient, doing a 6-point pocket chart, or speaking to the patient about periodontal disease, the depth of knowledge that you gain from the program, it's like embedded in your head, and it starts affecting the way you speak to patients. And that's the key thing. If the patients have the confidence in you, they don't look at your title at the end of the day, whether you're specialist or dentist with special interest, but it's your knowledge and skills that you apply. And like Jacopo said, it just opens up different venues. So if you're interested in teaching, if you're interested in conferences, if you're interested in research, I, for one, never thought I'd be interested in research. And now I'm looking for ideas. I've done my year of research, which was traumatic, but I survived. But at the end of the day, I'm more interested now in research, and it just opens up your minds for so many different avenues that you can explore after you qualify. So I've got only positive things to say. It does require commitment as well. So like Jacopo said, the 1.5 to 2 days are a must, because the content is a lot and you need the time to understand and grasp and apply. So you really need this time, but it is very doable, and I'm a living example of that.
Thank you, Nancy. Really happy to hear that feedback from you. So I think, yes, you really provided all the information. So I'm just aware of the time, and we have many other questions. Let's try to see what else has been asked. Okay, so the next question is, if I have to stop at the 2nd year, is there any chance I can continue the next year to do the 3rd year, to the MSc? as Jacopo is also head of education, I'll let you.
No, I think the short answer is, I mean, this is so is a part-time program, is not a flexible program as such. However, typically, let's say we have a number of examples. If you, let's say there is 1 year you struggle and you need to interrupt your studies, you can do so and then commence the year after, or depending on the circumstance. So I think there is some flexibility to that regard. Isn't, you cannot interrupt and then, you know, for 3-4 years and then come back instantly. That's not something. But if it is typically one interruption is very easy to obtain, sometimes two. So I think from that perspective, I think, you know, there is some flexibility. Yeah.
Thank you. Yes, it's something that we face, I mean, all the time. Obviously, everyone has, you know, his life, and sometimes things may happen. So there is this opportunity. The next question is regarding payment in installment. I think this question can be directed to the admin team. You have the email in the chat. So I think this can be asked there.
Yes, I think
Yeah.
normally, I think you pay normally in installments, I think, in any case. But yes, I mean, I'm not able to give full details of that. But yeah, it's not all in one go. I think you have certain time point where you need to pay sort of over the year.
Thank you. The next question is from a dentist from Pakistan, asking, we get any certificate as we get online classes as I live in Pakistan. So just a comment, which is, I think, very important. It's okay to, I mean, you can join the program, I think, from anywhere you are, but from our point of view, we want to make sure that you are seeing patient regularly and treating patient, because some of the teaching is including assessment of your own cases and treating your own cases and documenting them. And also the second part of it is, again, depends where you live and what is the regulation and how, again, how this can be acknowledged by, again, later. So it's something that needs to be looked at the specific area where you live.
Yes, I think just Asia, do you mean the sort of CPD certificate type? Is that the question? Because we release anyway as part of the program. I don't know if that answers your question, but we have at the end of each year in December, we release a CPD type of certificates that cover the period. Yeah, so that's something, you know, like also for can be helpful if you for your registration. Okay.
We have a question regarding the dates for the October residential week. This needs to be still finalized.
It is. I think, yeah, it needs to be finalized. It likely will be the week of the, I think, of the 19th of October. Likely.
Yeah. It's either, yeah, that week or
By TBC yet, because we are finalizing these days. But normally it's that week in October, so it's likely to be there. Yeah.
Yeah. Thank you. Then Katya is asking how many complex cases we would get to see during the 3-year period.
So I'm happy to answer that. So just to clarify, so we are not, so you're not seeing patient, yeah? You're not seeing patient at the Eastman, yeah, at the hospital. So the case that you will be seeing are your own patient, yeah? So that depends on the population of and variety of patient you get. We discuss complex cases. We have case scenario or what we call unseen clinical case. So we give you, you know, an example of a case with complex medical history, advanced disease, etc., and you know we discuss about that. But you're not seeing patient as such in our patient, yeah, patient that belong to the ISMA, to the hospital, that attend the hospital as such.
Thank you. The next question is again from Asya. She's asking if as she said, she's coming from Pakistan and she's interested in the program and will be able to take the online sessions. However, if someone is not able to come face to face to the residential week. So, because again, we have only between 1 to 2 residential week per year, and this is the only opportunity to teach you face-to-face clinical with clinical supervision or clinical aspects. This is why the residential weeks are mandatory. So this is something again we really emphasize that it is important and it is a mandatory thing.
Yes,
Jacopo?
yeah, I think you're right, Asia. I think understand probably the challenges for you traveling, but these are, as Imba was saying, these are really, is not all the other elements. There is an element of flexibility, so we record the online, etc. But the residential weeks, because again, there is a direct practical component there. It doesn't work if someone is not physically present. But there are very rare exceptions. We do only if there is a last minute emergency or someone cannot really come. We try to organize something, but it cannot be a regular things. So it's
Especially
fortunately.
in the first year, I think, where we provide all the basic kind of concept of non-surgical thing that really show you practically, how to hold the curette, how to do it's very practical this week. So unfortunately, we cannot, we need you to be there. And lastly, we have the last question. Is this program available in 5 years' time? I'm in year 12 right now, who is interested in periodontics. So first, well done for your interest in periodontics. Hope that it will will still be here
Yeah,
in 5 years.
I hope we are one healthy, and two not still have the enthusiasm. No, is hopefully yes, hopefully yes. You never know. We know with academia. I mean, there is a lot of things change. Certainly at present, the goal is for the program to be there. And again, it's very nice to hear that you're already planning ahead, and your interest is there. So yes, so yeah, please be in touch with us. But I hope that we'll always be there.
Thank you. So thank you everyone for all your questions. We have 2 more minutes, maybe final kind of comments from Nancy, just again from her experience, and any things that you would like to mention.
Yes, so I've been obviously there a few years back, and ever since then, since 2021, I've been focusing only on perio. I do very little general dentistry now. There was always an opportunity for me to apply at different workplaces because you can think about it. There's quite a gap in the market for people who are interested in perio, so you will always find jobs. Anyone who places implants would want to get the patients periodontally stable because they place implants. And now with even treatments like Invisalign, no one wants to take the risk to start an Invisalign treatment in a periodontally affected patient. So in terms of work opportunities, it's out there. And in terms of the program, the depth of the knowledge that you get from this program, although there are no hands-on experience on patients, but you learn so much and you take this learning and you apply it in a clinical setting. And the supervisors are always there to help you. So every time I'm speaking to the patient about treatment outcomes, I remember Imba asking me, what are the treatment outcomes of non-surgical treatment? Every time I'm doing a surgery, I've got Jacopo's voice in my head. Where would you place your incision? What flap would you raise? So it stays with you, and it really, really gives you all the skills that you need to practice perio. So good luck, everyone. And if you've got any questions for me later on, I'm always available.
Thank you. Thank you very much. I think we ran out of time. So
Yeah.
thank you everyone for joining. If you have any other questions, you have our emails here in the chat. Jacopo, any last?
No, let's go. Again, feel free to get in touch if you are interested in something, or indeed if you want to come over and see the facility, we can organize that as well. And thank you for your interest today, and thank you for attending. So I look forward
to see you next
some
year.
of you to apply.
Thank you, everyone.
Thank you. Bye bye. Bye. Thank you, Nancy, for joining. Thank
You're
you.
welcome. Bye.
Bye.